Many of these drivers have been stuck on the interstate for hours now, nearly a full day. No food, no water, nowhere to go. Many of them without a full gas tank, having to turn off their engines and restart their cars just to stay warm. For News Views Hughes, I'm Paxton Boyd.
Well, the disapproval of the Biden administration of the economy is actually so bad, even the mainstream media is having a hard time covering. In the latest CNBC Change poll, President Biden's approval rating has hit an all-time low at 60% of Americans who disapprove of his handling of the economy. Now, I want to give you some perspective. That's even lower, if you can believe it, than President Trump's lowest approval rating on the economy at 53%, which happened in June of 2020, aka during the initial effects of the economy from the shutdown of the coronavirus. So why is President Biden so unpopular? We have Angela Sloan, CEO and founder of Sloan Financial Group, alongside Steve Gill, former USTR official and under Bush and Clinton. Thanks for joining me.
Thanks, guys.
It's good to be here.
Okay, so Steve, I'm going to start off with you. Do you think the average American is angry at the current state of the economy? And if they are, who exactly are they blaming?
Well, I think everybody is angry and they're on edge because they're not only feeling the pinch with the higher prices of everything at the grocery store, higher prices of, everything they need to buy for their kids at school, but then when they drive around town, they're reminded constantly of how much higher gas prices are. I mean, bread prices may go up, other food prices may go up, but there aren't big signs all over town broadcasting it every day. And when people see the prices ticking up 20, 40 cents a gallon, and that's raising the cost of everything, it is just a constant in-your-face reminder. And I think that puts people even more on edge because of the economy, because they not only feel it, but they actually see it.
Well, and that's the thing, Angela. Who are they blaming for this right now? I mean, is it fair to put everything just after 1 year on one administration?
Well, I think that's the obvious place to put it because that's the obvious place that this is coming from. And you've got to understand that anger is born out of fear. So when somebody gets angry, they're angry because they're afraid of fill in the blank. So they're angry because they're afraid of they're not going to be able to afford to provide for their families. They're not going to be able to afford the next grocery bill. They're not going to be able to afford to get back and forth to work if they are still working. They're not going to be able to afford to buy a home in a lot of cases. So that anger is born out of fear, and it's because Americans are afraid of what's going on. They're seeing things they've never seen before.
Well, Angela, and
I think that blame goes right to them.
Well, and that's the thing, and I agree with you. I think it definitely is born out of fear. But I want to just, ask you this idea. As much as they're afraid, at the same time, workers, a record high amount, have actually quit their jobs. Actually, we're looking at 4 million monthly, which I think just sounds incredible, considering the crunch we are in the economy. What has changed, you feel like, the most in the present, the worker or the working conditions?
I think a little of both. So if you look at the police officers or the first responders, for example, what changed here? Was it the police officer or was it their working conditions? Obviously, it was their working conditions. You have workers that were forced to start working from home and, using the video cameras and whatnot for their meetings and not being able to interact with workers, and then all the corporate changes that had to take place, and they're frustrated. And the older ones, especially, the closer they were to retirement, are saying, hey, to heck with it. And I've got a lot of clients that are airline pilots that were calling me saying, if I'm forced to take this vaccine, I'm going to be at your door because I'm walking out. So I think it's a lot of both that has changed it. It's their job environment, and I think it's mostly the job environment, not so much the worker.
Well,
the other reason that you have workers. Mm-hmm.
Well, and that's what I think, and I want to go about that job environment. I'm going to toss this over to Steve, because anger from workers at their situation. Decades ago, it helped create the unions, and it justified why they were there. They were fighting for the workers to have better working conditions. But is unionization the actual solution for disgruntled workers in the present day, or are present day unions actually adding to the problem? Steve.
Well, I think the unions are adding to the problems because most of the things that the unions were fighting for before were better working conditions, were higher wages, were better retirement benefits. Most of those things are already in place. There is few opportunities for a union to get actual better stuff for their union members than they've had in previous times. But I think Angela has hit it exactly on the point. the working conditions, we're not just talking about police officers and firefighters that are being abused by the public. Those that are showing up for work are having to do more with less because so many other people aren't showing up for work. You mentioned the people that have quit. Some of them have quit because they're just so frustrated with being the ones showing up while people are staying home and getting paid, or because when they show up, the customers are angry because they're having to wait, the products aren't there because of the supply chain issues. There is a lot of frustration in the workplace, and then a lot of those folks are quitting because they don't want to get the vax, and they're quitting or they're getting fired, and then we're wondering why there aren't enough workers at the workplace.
Well, and that's very important when you look at hospitals right now, is, obviously the COVID numbers are up. People are also getting sick with everyday things like the flu, or people who've not checked their health for the last 2 years because they didn't want to go to the doctor out of fear. All of a sudden, what they had in the past is coming back worse, but there's not enough people within those hospitals to serve them because they've been either fired from the vaccine or sick themselves. It's really this hamster wheel we're in. But Angela, I want to go to you on this question because I know that both of you who probably go to the grocery store and have noticed the increase in prices, especially when it comes to meat. Now, President Biden this week has blamed this on this anti-competitive behavior of the meatpacking industry. And guess what presidents do best. They add more federal funding, billions actually, to get more companies involved in meatpacking. But the owner of one of those companies actually says Biden is ridiculous because the prices are escalating mainly due to the labor shortages and a lot of the restrictions that they're being forced to handle from the federal government. He feels this administration is actually keeping the problem. Do you agree with that? Is that ultimately the key ingredient to keeping your meatloaf so high in the present?
It's the labor shortage. I can tell you this from personal experience. I have one particular, he raises grass-fed beef. There's a high demand for grass-fed beef. Due to the shortage at the packing house, he's lucky if he can get one cow to the packing house a month. One per month. It's killing his business. It's killing his income. It's raising our prices because there's not enough workers to get this stuff processed. And I'm thinking, hey, as an entrepreneur, I'm thinking, hey, there's your business. There's your business opportunity. Start your own packing house. Well, it has to be USDA approved.
Right. Once again, government regulation.
You've got a lot of regulation and hoops to jump through to be able to do that. So I can tell you firsthand, looking at my client's situation, that it is the shortage of labor.
Well,
this man can get, he's lucky, one cow a month.
Well, Angela, Steve, we thought it was going to be the supply chain that was going to be the problem. But if you don't have the workers, it doesn't matter how much product you have if you don't have anybody to actually process it through. Not really a big best. And the only problem, the solution we're finding from the federal government. Yeah, there are no more cattle drives.
They're not doing cattle drives to get the cattle to the packing house. They're having to use vehicles, and that uses oil.
It's all just one hamster wheel. The government solution is let's print more money. Steve, Angela, thanks for joining us on this issue. Did you know Dr. Fauci is the second highest paid employee of the federal government? And he is set to receive the largest retirement package in American history at $350,000 per year plus benefits. Now, if that makes you angry, then you will not want to miss what we are going to talk about when we come back after the break, including all of the elements of frustration concerning the handling and restrictions imposed by the coronavirus and Dr. Fauci when we return. Tempers around the world are flaring as people are protesting against COVID-19 measures brought in by their respective governments. Now, here in the U.S., it is not any different, with many accusing America's top doctor of flip-flopping on policies as the new Omicron variant spreads across the nation. RT's Alex Mihailovich has this story.
Rage in Germany and violent protests in the Netherlands. These are just two examples of many in the public being fed up with the way governments are managing the COVID-19 pandemic.
The restriction measures are nothing to do with my health. There are people who want to impose the control upon us and take all our freedoms. I am here because I think that we all must be free.
America is not immune to the anti-government sentiment. Tempers are on the rise across the states as DC's top man in the war against the coronavirus is seemingly flip-flopping with his messaging on how to tackle the issue. The latest, Just days ago, the CDC dropped the isolation time for people infected with COVID from 10 days to 5 for anyone who is asymptomatic or has not had a fever for 24 hours. Now, Dr. Anthony Fauci is suggesting that before leaving isolation, Americans could be forced to test negative. Many see Fauci's latest statement as another example of inconsistent guidance from the government when it comes to COVID. And there are those who believe that policies related to the virus are being formulated from a political perspective. One example, some would say last Tuesday's CDC decision to slash quarantine periods in half was driven by an effort to prevent another blow to the economy instead of being scientifically driven. And there are other considerations when it comes to COVID-related government measures, such as their effects on mental health. A shocking result of the pandemic is that suicide rates have skyrocketed among young people. A Surgeon General's report notes that emergency department visits in early 2021 for suspected suicide attempts was 51% higher for adolescent girls and 4% higher for adolescent boys compared to the same period in early 2019. And according to the Children's Hospital Association, the number of suicide and self-harm cases in the first 3 quarters of 2021 was 47% higher among 5 to 8-year-olds and 182% higher among 9 to 12-year-olds than they were in the same period in 2016. Eric Clark is a behavior specialist.
You know, the kid's just really anxious, not knowing what's going on at home, not knowing what's going on at school. I've seen a decent amount of self-harm thoughts with kids that they just feel completely overwhelmed. They just don't want to do it anymore.
The bottom line, the pandemic has reached much further than just the direct effects of the virus. However, as the mainstream media and governments continue to sound the alarm on Omicron, many experts are saying that the COVID-19 variant could be a blessing in disguise. It has become clear that Omicron is much milder than previous strains of COVID-19, causing substantially fewer deaths and hospitalizations. With predictions that Omicron will peak in the US by mid-January and that infections might rapidly drop after that, as they did in South Africa, better days may be ahead sooner than later. And hopefully the government will be able to manage the transition back to normal better than it has the pandemic. For News Views Hughes, I'm Alex Mihailovich.
Okay, so I want to discuss why there's been so many moving parts to this virus from the very beginning, and if we as Americans should be angry at how the U.S. government has handled this pandemic. So let's bring in our guest, Dr. Anthony J. Santella, professor and director of the Doctor of Health Science program, and our friend Lionel of Lionel Media. Thanks for joining me.
Thank you.
So I want to start with you, Dr. Santella. You know, we have come a long way. I remember when this first started 2 years ago, you had to go to a medical facility to get tested. It was a long Q-tip shoved right up into the brain. And if you were positive, you could always tell which car was positive because a guy coming out in a hazmat suit where you thought they were going to be taken away would deliver the news to the car, and then you would see tears thinking it was the end of the line for them. Now, we have people able to pick up a take-home test at your local drugstore. Why such a dramatic difference in just 2 years?
Well, first and foremost, thank you for having me. It's nice to be here with you. You know, while the coronavirus is not a new virus of families, we understand it now after 2 years of dealing with it. The early days, those first few months, it was chaos. You're right. There were long lines. People were confused. They were not sure what to do with themselves. And we've evolved a lot in the past almost 2 years with our ability to develop quick, at home, those rapid antigen tests, to have effective treatments for people who are mildly symptomatic to avoid hospitalization. We know the importance of wearing masks and other kinds of public health mitigation strategies. So, you know, as science has evolved, so has our public health guidance and mitigation strategies.
And I agree with you. Science definitely on this issue has followed. Like you said, this was the coronavirus. I mean, you already had it printed on Clorox labels that they fought the coronavirus. Maybe not COVID-19 at the time, but you're right. This is a family of viruses that we've known about. But one thing that's never entered into the coronavirus debate before has been politics. So I want to bring in Lionel. You know, why do you see this dramatic shift in COVID protocols? And does it seem like there's political pressure that's actually been involved as we've developed over the last 2 years? We've changed presidents, changed powers of political parties. Do you think that's played a role?
Oh, of course, everything. And by the way, I feel so sorry for the medical profession. You know, I've got friends and you've got friends, and the doctors and the nurses, they're doing the best they can. They have been consistent. So hats off to them. But you have to ask yourself, imagine, Scotty, if there's some life force watching us and they're saying, these people, they take vaccines. And when they take the vaccine, that's not enough. And then they get a booster, and that's not enough. And then they get COVID, and that's not enough. And they get tested, and that doesn't mean anything. And it's just this never-ending confusion. And also, you see such disparate reactions. In Florida, they don't know what COVID is. In New York, where I am, it's the Black Plague. So is it politics? Perhaps. Is it control? Is it the usual amount of chaos? But I got to say one thing. I think without a doubt, and I know you can't ask doctors to admit this, but let's just say this. Anthony Fauci is a joke. Nobody listens to what he says. This is the man who a couple of years ago says, masks, you don't need a mask. They're not to help. And then the next thing you know, he's wearing 2 of them. And it just got worse. Next week, Fauci's going to say, tattoo your forehead. And nobody's going to listen. We're going to say, okay, fine. Eventually, we'll come to our senses. Maybe there'll be better therapeutics. God bless the doctors and the researchers, the people who really know what's going on. Keep the politicians out, and let's just hope for the best.
Well, and I want to add one element to what you were saying in your steps there, Lionel. It wasn't the fact of just, get the vaccine and then you'll be fine. It was beforehand. They promised us. They said, if you get the vaccine, you're not going to get the virus. I mean, that came from Joe Biden's mouth. If you, wear a mask, Dr. Fauci said, don't wear a mask before he said, wear a mask. Right. I think that's the problem. People were promised, so they did inaction, and then that didn't happen, including this latest one that's come out. Dr. Fauci said this last week.
Is that if you look at the children who are hospitalized, many of them are hospitalized with COVID as opposed to because of COVID. And what we mean by that, if a child goes in the hospital, they automatically get tested for COVID, and they get counted as a COVID hospitalized individual, when in fact they may go in for a broken leg or appendicitis or something like that. So it's overcounting
for COVID. That was probably the most honest interview that I have seen Dr. Fauci do in 2 years. But as a parent who was concerned about these hospitalized numbers that were going through the roof that I was seeing every day, meanwhile, the kids in my own neighborhood were testing positive, but they had a sniffle. I was dealing with the flu strain A that was putting my neighbor's kids in the hospital. So, Dr. Santel, let me just ask you, why is this now just being said? And do you think down the road we could see this apply to the percentage of adults who were hospitalized? Could they have gone in for something else and tested positive for COVID? What's the difference between now and children and the past with adults?
So first, let me just clarify. I'll have to disagree with my colleague here. I don't think Dr. Fauci is a joke. He's someone who's committed his entire career to virology, immunology, fighting the good fight with other issues of public health significance like HIV and AIDS. I will say there could be room for criticism with the way federal government, including people like Dr. Fauci and Dr. Birx and others, have kind of accepted that political pressure to change their message and to kind of comply with these kind of norms and standards that really weren't meant for the American public. But yes, data is nuanced. That's what those of us who study public health and epidemiology